All right. Good afternoon. It is Thursday. Time for our Team Kentucky update. And last week, we started with the good news. That felt pretty good. We all need good news. And we're going to do the same today because, like last week, we have some special guests. On Thursdays, we like to put a focus on the tremendous economic momentum we're seeing week across week here in the Commonwealth. We truly have an economy on fire with an opportunity for levels of prosperity many of us never dreamed were possible. This is our time. This is our chance. It is a special moment here in the Commonwealth going on at a time when we're also dealing with great difficulty. We have three exciting projects to talk about today that show how Kentucky is emerging as a hub for innovation and technology. First, we have great news about a medtech product out of Bullard, a long-standing family-owned company based in Cynthiana that develops and produces safety equipment and PPE. In other words, Bullard has the technology and makes the advanced equipment that is keeping our healthcare heroes safe as we continue to wage war against this deadly coronavirus pandemic. Bullard has developed, tested, and recently began manufacturing an innovative respirator that is designed to help our frontline heroes battle COVID and beyond. Now, the company is launching that device called a Powered Air Purifying Respirator, or PAPR. The device offers increased protection and comfort for medical professionals and others. There's a lot that's notable here. Bullard is a fifth-generation, family-owned, Kentucky-based business, a family I've known for several decades. It has global operations in Europe and the Asia Pacific. They make us really proud here in Kentucky. As the pandemic took hold last year and global demand for PPE skyrocketed, Bullard partnered with Toyota Motor Manufacturing in Georgetown. Working together, Bullard gained efficiencies and ramped up productions of its existing respirators while expediting development of this new, exciting product designed specifically for healthcare workers. This is the very best of Team Kentucky, showing the best, rising to the best during times of great difficulty. It shows how that we're living for one another, forging new partnerships, being willing to try new things if it means ultimately better protecting each other. This is a partnership and a product that all of Kentuckians can be proud of. So what does a respirator do? It provides respiratory protection by supplying filtered air to the user. This new product does that and so much more. Today, we're joined by Wells Bullard, the company's CEO, and Landon Borders, Director of Product Development. They're here to share more information about their new PAPR.
So thank you, Governor, for inviting us to showcase what our incredible team has accomplished together in order to protect healthcare workers. So while in the pandemic, healthcare workers on the front lines have been desperate to get the protective equipment that they need to protect them from this virus so that they can do their really important work of protecting patients afflicted by illness. And so our team at Bullard has responded in two ways. One, by increasing our capacities so that we could make as many respirators as possible to protect as many people as possible. And two, by pivoting our development efforts in order to develop a new powered air purifying respirator, or PAPR, in order to protect healthcare workers. So simultaneously, the National Institute of Occupational Safety and Health, NIOSH, developed and launched a new standard that for PAPRs specifically for healthcare workers. And so this new product that we're going to show you is developed to that new standard, specifically designed to help protect workers in the healthcare field. Healthcare workers have worn PAPRs for years, but the Bullard Salus HC PAPR is a better solution because it's truly designed to be comfortable, to be easy to use, and also to enable better care through better communication. And so this product is, as the governor said, designed, developed, and manufactured right here in Kentucky in order to protect nurses and doctors and clinicians and first responders around the Commonwealth and around the globe. So with that, I will introduce Landon Borders, our Director of Product Development, to walk you through the product.
Thank you, Wells, and thank you, Governor Beshear, for having us. And I think you did a great job explaining how it works, but I'll provide a little more information here. So this is the Salus HC Papper. And as Governor Beshear mentioned, it removes particulates from the atmosphere and provides clean, breathable air to the person who's wearing this hood. As Wells mentioned, this was designed specifically for healthcare use cases. We wanted to make sure that we're touching on some of the pain points for healthcare professionals across the globe. I'll demonstrate how the product works. One of the things that we knew that we wanted to do was make it extremely comfortable to wear. Traditional pappers are worn around the waist and they're not designed necessarily for all-day use. And we knew that healthcare professionals are using the product for many hours on end, and we knew that comfort was extremely important to them. So we designed it in a way that's different from how pappers are worn today. As you can see, it's extremely comfortable. It's worn around the shoulders, which is much better for supporting weight. It's very easy to use, one button operation to turn it on and adjust the speeds. And it delivers the air through this breathing tube into this hood that is designed to make it very easy for a patient to see the doctor's face or a nurse's face, to communicate, and it rests around the ears to keep them exposed so the doctors can use stethoscopes and to hear their patients better. So when it's worn, as you can see, you can clearly see my face. So very comfortable, easy to use, protects our healthcare professionals so that they can in turn treat our patients. And not to mention easy to get on and off so that doctors and nurses do not have to spend a whole lot of time taking their PPE on and off. So as well as mentioned, we're currently in production and taking orders today, and happy to help anybody that we can. So with that, I'll turn it over to Wells Bullard.
Thank you, Landon. So I just want to say, as a 123-year-old business that's dedicated to protecting workers in hazardous environments with personal protective equipment, we are just so thrilled to have this new development to bring to healthcare workers. And I just want to say a huge thanks to our incredible team at Bullard, to our amazingly brave customers, and then also to this incredible Commonwealth for supporting us. And so thank you so much, and be safe.
Thank you. Thank you.
It's a great company that has protected everyone from our miners to our healthcare workers. And with everything we went through with PPE, especially at the beginning of this pandemic, being unable to get certain type of masks or other equipment, having a Kentucky-based company leading us into the future makes us more resilient, eliminates some of those supply chain issues that we saw in the past, and it's going to lead this Commonwealth in special ways. These announcements we've been making, including that one, are all about jobs of the future, about us being on the cutting edge here in the Commonwealth. And what we'd say to everybody is buckle up. There's a lot more of that, a lot more great things to come in the coming weeks and months and years. Today, I also want to highlight a great development from another technology-driven business that's going to create more than 60 good-paying jobs in Northern Kentucky. Yesterday, I announced that third-party logistics firm Lighthouse Transportation Services, having outgrown its current office space in Covington, we like that. That means that things are happening. We'll move to a larger facility in the downtown there and create 64 additional well-paying jobs for Kentuckians over the next decade. Lighthouse provides logistics services to Fortune 500 companies, as well as supply chain technology and managed services to small and mid-sized shippers. Well, this expansion serves as yet another shining example of how we do logistics better than anybody in this country, bar none. It also showcases our strong support of tech-driven businesses like Lighthouse. The company's recent growth is fueled by new strategies that make the company more technology-centered. It prompts increases in efficiencies and customer demand. This new philosophy helped Lighthouse more than double its revenue from last year. Most of us would really like that, while landing several new customers. Let me say that again. Despite the challenges we faced this last year, Lighthouse doubled its revenue. That's incredible, but folks, we are seeing those types of numbers across the board. Lighthouse is a great representative of Kentucky's thriving logistics and distribution industry. It employs over 80,000 people, this whole industry, at 590 facilities statewide. And as e-commerce continues to boom and grow, Kentucky's leadership in logistics is only going to get bigger. So congratulations to Lighthouse on this great expansion. I want to thank the company's leaders for their continued commitment and faith in us. In many ways, what we are able to do once we get the opportunity to meet with those planning great things is to show them our commitment, and we follow through. I'm proud that this state, under many different governors and leadership, has always been a good partner to businesses that want to help our families and grow. All right, this next one, the third one, is pretty neat. So we have more great news from our signature bourbon industry, which these days is a major part of Kentucky's tourism industry as well. Horse Soldier Bourbon, an ultra-premium bourbon brand founded by retired members of the U.S. Special Forces, just announced plans to create more than 50 jobs with a new $200 million development project in Pulaski County. Talk about a backstory. So the founders of this bourbon were part of a Green Beret detachment who were the first to enter Afghanistan on horseback after the terrorist attacks of 9/11. At the time, the team was training on the Cumberland River, and now the founders of Horse Soldier Bourbon are returning to Somerset, that same area, to create the first Southeastern Kentucky distillery experience, which will also serve as a southern gateway to our legendary Bourbon Trail. Horse Soldier project's plans are extensive. They're going to build a 27,585 square foot visitor center, a 4,600 square foot activity center, a 5,000 person capacity amphitheater, a 500 person outdoor event space, a 3,200 square foot wedding chapel, and an adventure area. A lodge, cabins, and retail village are also planned. So big dreams, big plans, really exciting opportunity. Throughout our pandemic, the spirits industry has remained a bright spot. Today, roughly 70 spirits facilities employ more than 5,100 of our fellow Kentuckians. In 2021 alone, the industry has seen 12 new location or expansion projects with over $270 million of new planned investment and 267 announced new full-time jobs. It's also lifted and continued to grow our $8.9 billion tourism industry here in Kentucky. In Pulaski County, tourism supports 1,025 jobs, and it generated $115 million in economic impact in 2020, even in the midst of this pandemic. This year, the Commonwealth's approved 6 tourism development projects for a total investment of nearly $183 million to companies seeking to expand operations in Kentucky. So congratulations to Horse Soldier Bourbon. John, their CEO, congratulations to you for all of these incredible individuals. Thank you for exemplary service and heroism, and thanks for coming back and bringing this unique opportunity. I think it's going to be a great success. We are so excited to have you in the Commonwealth. These exciting announcements, again, show just how exciting a place we are in terms of economic development. We are in a place and on the cusp of the level of prosperity where no one will ever see us as a flyover state ever again. No one will look down their nose at us ever again. We're going to be the destination. And we're being talked about in boardrooms that had maybe never even heard of us 5 years ago, and they're suddenly investing in us now. Again, this is our time. A post-COVID economy is going to be entirely different, and it's our chance to lead. I mean, we look at what we've done already this year, $2.8 billion of new investment. We are going to easily double that by the end of the year, if not triple it. 6,600 new full-time jobs thus far announced this year. We're going to at least double that. Second highest average hourly wage ever for those new jobs. So they're not just new jobs, they're good jobs. And what that means is opportunity for so many more people in Kentucky. We've gone through before a couple of these, but listen, they're exciting. Amazon Air, now operational in Northern Kentucky, creating more than 2,000 jobs, largest project in that company's history, and it's in Kentucky. In Henderson, Pratt Paper, going to create the newest, cleanest, greenest, most technologically advanced recycled paper mill in the world. 320 jobs, $400 million of new investment. It's going to save tens of thousands of trees every day it's in operation. Fruhoff, semi-trailer manufacturer, 288 new jobs in Bowling Green. Kruger Packaging, 150 new jobs in E-Town. Velan North America, 75 new jobs in Louisville headquarters, another 75 in Shelby County. Firestone, 250 new jobs in Whitley County in the EV market. Kentuckiana Curb, 700 new jobs in Simpsonville. Metalco, 60 new jobs in Franklin. Nucor Tubular Products, 72 new jobs in Gallatin County. Fidelity Investment, 600 new professional jobs in Covington. And that leaves out so many more. Multiple new projects in Trigg County, Dollar General in Northern Kentucky, and so much more. So yes, we are going through a difficult time in the pandemic, but our future has never been brighter. And I get that that's hard to process. It's hard for me too. It feels in many days like you're living in two different worlds, but it ought to give us the motivation to do what it takes to beat this virus fully and finally, so we can step into that sunshine and sunlight that we have been looking to live in again, and truly embrace what all that we can be. So with that, we'll have to turn a little to that darkness. Our update today on COVID. First, just going over our stair-stepper chart that we looked at on Monday. We are hoping that in the very least, we are plateauing in terms of new cases. Certainly our hope is that we will start to see a decrease. Let me say, in past surges, we have been able to handle the plateaus because we've had the hospital capacity. We've been able to do that in the past because we masked, and we could put out orders on masking, and the people of Kentucky would do it. A plateau at the level that we've reached, one that we could not reduce through masking because that authority was taken away. If we plateau at the level we're at right now, we cannot sustain it in our hospitals. It is too much, with too many people sick, with more people per sets of cases getting sick because the Delta variant is more aggressive. So I'd ask everybody again, more people we get vaccinated, the more you're willing to choose to wear a mask when you're indoors and outside of your home, the faster we can get this thing on the way down. And let me just say that while we do see some decreasing cases in areas to our south, we also see their hospitals still overrun in much worse shape than ours. So we've got to remain vigilant. Positivity rate. We now do think that this decrease is real, though we don't know where it'll plateau. So certainly when we reached 14%, that was the week of Labor Day, and so there weren't enough people that got tested. But it does appear that we're going from a place where we were at about 13% positivity down to 12, or just a little bit below. Again, we'll have to watch that, but this is typically a leading indicator. What we'll want to see is that it continues to drop week after week and doesn't plateau at an 11 or a 12, which again would be the highest in the pandemic, except for 1 week in the toughest part that we have been in. Our census for our hospitals does appear to be decreasing slightly. Obviously, this is still significantly more than we had at what was the previous height of the pandemic over the winter. So we need to decrease more, but let me just tell you, the way we were increasing and the speed was exponential, was so dangerous. So it is at least good to see a bit of a decline there. But we're not quite seeing the same in ICUs, where we're seeing more of a plateau. and again, this is a plateau where it's really more people in the ICU than we would have traditional beds for. Remember, we've converted them. ERs have been turned into them. People have set up tents to triage folks so that they can turn surgical rooms into ICUs. And remember that when we reach a plateau, it's never exactly flat. It's always a little bit up and down. That's a function of reporting. And if there's one of these that concerns me the most, it's ventilator usage, which continues to climb. This is going to trail cases, and it's going to trail the original ICU numbers. But we have more people on ventilators now than we ever imagined were possible. A respirator is a good thing to have. It's one that protects you and ensures that you are breathing clean air. A ventilator means you can't breathe on your own. Vast majority of folks on ventilators are unvaccinated, and we need more people to get vaccinated. Remember, you could choose to get a shot that protects you. It's really safe. Over half the country has already taken it. Or you can rely on infusions and potentially a machine just to help you breathe, hoping that they can keep you alive. The shot is a lot more effective and a lot less intrusive. So let's look at just our update on vaccination status, cases, hospitalizations, and deaths. Just the one number I'd point out, the 92% of hospitalizations, unvaccinated Kentuckians, that's holding. It's actually increased a little bit from about 90 to 92%. What that means is while there are breakthrough cases, and while there are sometimes tough outcomes in those, especially in people who have are kind of in the danger area already and were since the beginning of this pandemic. If you get vaccinated, your chances of getting so sick you have to go to the hospital are really low in the midst of this pandemic. So please, for our hospital workers, get vaccinated. And I know we've talked about our hospitals and our hospital workers a lot. Remember, the two most effective ways to reduce the number of people coming into the hospital, and thus the most effective way to address staffing, having enough people for enough patients, is to reduce the number of patients. You can do that two ways. You can get vaccinated and you can wear a mask. The cheapest, most effective way of addressing our entire healthcare crisis right now would have been requiring masking when people are indoors just during this really terrible surge. It works. It's worked 3 times. The fact that we couldn't do it this time has put so much more stress on the system. Let's also remember that when we look at cases by vaccination status, that while the Delta variant is not that one, we'll come to it. Not that one either. This one, the 4.5 times more. There we go. That while this is a more aggressive variant, the vaccines provide the same level of protection that they did since the very beginning. Yes, you should do a couple more things to protect yourself because what we're fighting is that much more difficult. But its reduction or level of protection, however you want to look at it, has held in any different graph you look at it. So it provides you that much better protection. This is getting COVID. And then remember the 92 to 8% unvaccinated versus vaccinated about being hospitalized because of COVID. And then if we look at the age and vaccination status of COVID-19 deaths, this is one that we haven't shown before. What it does show is why we need the boosters. And 70 plus, that's the group that is still the most at risk, and we need to make sure that their level of immunity remains high. It's also the group that at least the studies suggest immunity begins to wane in the most. But I want you to look especially at 0 to 49 years of age, right? Those are people we're seeing in the hospital, and those are people that we're seeing dying that we never, ever did before. And with very few exceptions, they're all unvaccinated. Meaning if you are that age, you are no longer invulnerable. You weren't in the first place, but you can't feel that you are invulnerable any longer or won't get really sick from COVID. But here's what I can tell you. If you get vaccinated, you're going to be okay. So we need this group. Remember, especially 12 to 29 is the group that we need to get vaccinated the most. And I got to tell you, the 11 unvaccinated deaths that are over there, with just one exception that I can think of, are all very, very recent. This is what the Delta variant is doing. Actually, this is since July, so it's all the Delta variant. And then finally, another way to look at that is the age distribution of COVID-19 deaths. The first people vaccinated were our older Kentuckians, and while they are still the most at risk of a breakthrough, that's why we're having the booster, look at this level of protection that it is given. To move from 3/4 to less than half of overall COVID deaths is incredible. It shows you the power of these. But less vaccinated groups, like 30 to 49, have grown significantly, 5.5 times during that course. So please get vaccinated. Looking at our hospitals, we think that there has been certainly a slowing of growth, if not fewer people in the hospital, which there are today, than we had at the height, but it's not evenly distributed. So we still have a lot of hospitals in crisis, 64 of 96 reporting critical staffing shortages. We have 130 ICU beds available as of today. Remember, that's always floated. We got down to 80 at one point. Never really been above 130 in the last couple weeks, but shows you how quickly things can change. 21 kids in the hospital with COVID, 8 confirmed in the ICU. These are likely only the 2 pediatric ICUs in the state. We have 5 kids on ventilators because of COVID here in the Commonwealth. Where we are on monoclonal antibodies, already this week, 90 acute care hospitals have administered 4,385 treatments. Remember, we are getting under 5,000 treatments for the entire week. Now, there are some on hand that we got before the federal government started rationing. So we will, over the next couple of weeks, be able to provide more of these treatments than we are rationed, but there is not going to be enough. We see these being very popular with folks that don't want to get vaccinated, but the moment they get sick, want to get the monoclonal antibodies. I'm just trying to tell you, there's not going to be enough. Don't put yourself in the position where you show up hoping to get these and we've run out because so many other people are in that same situation. Do want to give a special shout out. We've been seeing from our hospital systems great collaboration in ways we never saw before. These are major systems. They're also regional and urban. Taylor Regional has been working with Norton's in some different telemedicine as well as consultation, especially as Taylor deals with sicker patients than ever before. We're seeing these types of collaborations really grow. And I think it's going to be a really good thing for us long term that's going to provide better help for everyone. So we talk about what we're doing to help our hospitals each time we get here. The first has been the National Guard. And today I'm reporting we have now increased our National Guard presence. We have now deployed 505 Guard members to 29 hospitals throughout Kentucky. So it's about another 100 or 95 Guard members. That's another 5 hospitals that we have added, or 4 hospitals that we've added for assistance. We continue to hear from our hospitals how much these incredible professionals help. They do things like logistics, administrative support, screening, cleaning equipment, and assisting with other needs so that hospital staff can be 100% focused on patients. This was the largest deployment of our National Guard for a healthcare crisis in our state's history before we increased it by this extra nearly 100 Guardsmen. We appreciate their continued service and sacrifice, and we have found that this is one of the most helpful things that we've been able to do. These are professionals provided at no cost that come in and help significantly. Second piece has been the FEMA strike teams. They come in 2 forms, right? The EMS strike teams and the medical strike teams. So we have had 5 EMS strike teams here in the Commonwealth. We had one medical strike team that did 2 weeks at St. Clair. And yesterday, I believe we were grateful to announce, maybe the day before, that our request and my request to the National Disaster Medical System, or NDMS, was approved, and a team arrived at Appalachian Regional Healthcare in Hazard yesterday for a 2-week stay. Earlier this month, we had that team at St. Clair. It provided real significant relief, and we're excited that the same is going to happen. ARH Hazard has been hit really hard. Their people are putting in incredible work, but this team is desperately needed. I've also requested a 30-day extension of those 5 EMS emergency medical services strike teams, and we are awaiting word on that. They have played a crucial role. Again, highly trained, highly skilled medical personnel that have been able to come in at no cost to the regions and the hospitals that they are in to provide direct help and to free up our other professionals to ensure that they are either making regular emergency runs and or helping in our hospital systems. Let's look at our maps again, like we do. So this is the National Guard, 505 guardsmen and women deployed around our state. Again, 505 bodies provided at no cost and huge help to these facilities. We've also taken over testing at different facilities in different areas. Again, freeing up bodies and providing medical services at no cost to these locations and potentially looking at more. Remember, this does not include the school services that we are hoping divert people from going to the emergency room. Don't go to the emergency room if you just need a COVID test and you're not really sick. Please go to a testing location. kycovid19.ky.gov has it. And then we have our incredible nursing students, again, deployed, providing services at no cost to these hospitals. Though I will say the partnerships that are growing here are really exciting too. We had a huge nursing shortage before this pandemic. I think 6,000 openings pre-COVID, and our administration, and I think the state legislature working for us, is going to work on some long-term plans to address that. But oh my goodness, this is an army of folks who are decided to dedicate their lives to helping people that have voluntarily, in the most difficult time that we have had, headed out to help so many. So if we put those all together, our map looks a little bit like this, except that's not fully complete. So we talked about the Guard at 29 hospitals, testing at 6 different locations, nursing students, 27 different hospitals. But our AmeriCorps volunteers are now in our hospitals as well. Right now, they are operating in 2 of the most challenged hospitals. They're going to be in a 3rd in Advent, Manchester, here in October. But let me tell you, we're the first people to do this. And I think we got some Joe Bryn-Gardner and everybody else who run this area for Kentucky are pretty incredible. But the AmeriCorps National Civilian Community Corps has told us and confirmed that we are the very first to use AmeriCorps folks to help hospitals for surge capacity. It's been so influential nationally when they've looked at it that the leaders from the feds are flying to other states to try to replicate what we have started here in Kentucky. So pretty incredible, but incredible people are what truly drive that. It takes something real special to sign up for AmeriCorps, and I know those folks are happy to help out. Also wanted to highlight, and I've got a breakdown in here somewhere, other help we've been doing since day one to our hospitals in different ways. We think right now in extra funding, since the beginning of COVID, we're at about $1.8 billion additional dollars provided to our hospitals, primarily in additional Medicaid reimbursements. So about $400 million of this are a couple of different settlements that had sat around for a long time. But when we had COVID that hit immediately, that was the time to get them those dollars, and that was a good way to do it. $1.129 billion in additional reimbursements in ways we were able to change how that reimbursement works. So we will continue to work there because this makes our hospitals healthier in the future. Also was able to work with universities on a lot of the different testing that we did and a lot of the services, more than $332 million flowing into our universities from expenditures that we have made to battle COVID. One of the things that they did, our universities did so well that are a part of that $330 million are vaccinations. Yes, we need to vaccinate more people. But if we step back and we look at what we've done in the short period of time, it's nothing short of amazing. Now, we need it to be better because people are dying. But now having vaccinated 2,667,900 Kentuckians for a virus that isn't 2 years old, never been done before, I don't think, in human history when we look at what's been done here and across the country. We are now up to 60% of all Kentuckians having at least their very first shot of hope. That is 60% of everybody. That includes people who are ineligible. That includes people who have a health condition that can't get it. That is 60% of everyone. When we look at those that are eligible, still at 70%, and those that can make their own decisions, adults, now 72%. As we go through the demographics, because we've had some increases here, still sitting at 91% for 65 and up. 91% is hard to move. It means you need to reach harder to reach people. This is an area we have to, so nobody let up. 50 to 64-year-olds now hit the 80% mark. That's great. Make sure you get your second shot, and then find your friends that are part of the 20%. And please ask them to get vaccinated. The next two are the same, 40 to 49 and 30 to 39, both in the 60s. 18 to 29 increased 1% to 51%. A lot of room to grow here. And this is the group that is getting COVID more than anybody else right now. And then 12 to 17, up 1%. We want to see that. But again, huge room for growth there. We really need to see 12 to 29 if you were really going to have an area where you could make the most difference by outreach, can truly make a difference. But remember, we got to make sure everybody 65 and up gets vaccinated and gets your booster. So right now, regardless of what age you are, but certainly if you're 65 and up and you have real health conditions, make you immunocompromised, make sure you've gotten your shot. You can get it today, your third shot. You can get it today. Otherwise, I think in the next couple of weeks, everybody 65 and up is going to be recommended to get a third shot 8 months after your second one. So that's how you determine it if you're over 65. If you got real severe health conditions, go get it now. If you don't, first, good. But second, 8 months after your second shot, once the CDC says, okay, is the time to go get it. All right, finally, our Team Kentucky All-Stars. So this week, the Lieutenant Governor and I got to celebrate National Adult Education and Family Literacy Week by signing a proclamation and launching the new My Story Reimagined campaign. It promotes Kentucky Skills U, the state's adult education program in the Education and Workforce Development Cabinet. By featuring the stories of 8 real Kentuckians, these are amazing individuals. They inspire so much hope. Each has a unique story that can lift other people up. The campaign's going to encourage more than 300,000 working age Kentuckians without a high school diploma or GED to seek services and get that GED. Y'all might remember in the beginning of this administration, we were busy. We jumped out and did a lot of things, from restoring voting rights to rescinding a Medicaid waiver, which, thank God, it meant about 100,000 people stayed on health care when this pandemic hit. But we launched a program that removed the fee for GEDs for folks that couldn't afford it. Who would have thought $125 was holding back so many people from bettering themselves? But it was. And that program has been incredibly successful, and we're going to keep it up. We're going to make sure that no one is ever prevented from getting that high school diploma or equivalency because of cost. So these folks have shared their stories. They are phenomenal. They include Kelly Jo Blair from Martin County, Michael Kurd from Anderson County, Xingjia Ding from Jefferson County, Mason Hampton from Pike County, Maria Hill from Russell County, Daniello Pickett from Warren County, Ginger Sparks from Warren County, and Bonnie Sprinkles from Taylor County. We are proud of each and every one of them. They are our adult education champions. They're also Team Kentucky All-Stars. All right, with that, we'll open it up for questions. We got 2 journalists in the room and about 7 virtually. So, Carolina.
You went over the way everything is looking currently, and you say it appears we may be plateauing, but where we are plateauing, those levels are not sustainable right now. Essentially, is this good news? Is this bad news? How should we be interpreting this?
It's hard to classify it as good news, but it could be worse. The exponential increase we were on in hospitalizations already had us bursting at the seams, if not breaking in some places. But if it had continued at the rate that it was, every single hospital would be overrun. We would be turning people away from ICUs. I mean, you could see people dying in the hallways. We do not appear on that trajectory anymore. I would note caution that there were some states like Florida that seemed like they were leveling off and then had an increase before now being in what does look like a plateau or a decrease. It's overall good news, but we're still in a very dangerous situation is how I would describe it. You gotta stop growing before you can start shrinking, but we really need to start shrinking a whole lot faster. Tom?
Thank you, Governor. With the recent action by the General Assembly, are there any other rabbits you can pull out of your hat to help combat the pandemic?
Well, we try to be innovative each day. The AmeriCorps is an exciting new opportunity. Certainly the expansion of the National Guard being very helpful. I think that the stockpile that we created has come in very helpful. I do think the decision of just about every school system to continue masking is going to help us during this very difficult period. It certainly cuts down on the spread. Working to make sure that we're getting monoclonal antibodies out to each part of the state and in the best amount we can is critically important. And we're going to continue to look for other opportunities that are out there. And they don't all come from us. The collaborations, Taylor Regional and Norton, for instance, but those are all over, are truly exciting. Fayette County, I think, is going to continue with their plan as long as the shortage of monoclonals don't stop it, of having their health department with a couple other folks to provide those treatments, and that frees up a few in hospitals. But there's a lot of hospitals that don't want to do that because folks come in really sick and they want to be able to treat them there. But I think that there is both private sector innovation and we're going to continue to listen. I'll tell you, the nursing students started at a picnic honoring nurses where I entered a conversation with the Galen folks about the need that's out there. And they said they wanted to help, and look at where we are today. So I think if we keep our hearts open and our ears open, we can find more ways to help. All right, Stu Johnson, WEKU. It's an outdoor picnic. I was wearing a mask.
Thank you, Governor.
Go ahead,
Thank
Stu.
you, Governor. I take it Dr. Stack's not in the room today. This might be kind
He is
of
not.
one more for him, but okay, let me ask you this. Someone in my family who's retired medical professional mentioned to me the other day about the situation with those who have had COVID. Unfortunately, those who have passed from COVID, along with those vaccinated, there'll come a point where we have that so-called herd immunity, and then maybe we would have a yearly coronavirus shot, much like a flu shot, every year, annually. Do you think we're headed toward that? I mean, it's who knows?
Sure. I don't think that we know yet, but I do think we can look to the past. We all get a polio vaccine, and we don't have to get it every single year. That was a pandemic. We all get the Spanish flu vaccine and measles and others, and we don't have to get those regularly. And many of those were major pandemics. So I really do think it depends. The vaccines are holding up pretty well. If we got everybody vaccinated in enough time here in the United States and probably across the world, and it stopped mutating, then we might not have to into the future. What I will say is if we're at the point where we have to take one every year, it means we are ahead of the virus. We've learned how to deal with it, and we've set up a system that would just run alongside the flu shot that we get each year. So still early. I know there's a lot of smart people who think different things about it, but I think they're all giving their best educated guess at this point. I tell you how we'd find out is get enough people vaccinated to reach that herd immunity. And let me remind folks that if you have gotten COVID, you still need to get vaccinated. That's a scientific study from here in Kentucky. You can't get better, more localized data than that. Josh James, WKY.
Thanks, Governor. Could you elaborate on the long-term plans I think you mentioned are being developed to help with the healthcare worker shortage? I know you've said the ARPA money that Republicans want to use doesn't exist. Senator Alvarado responded this week that lawmakers could redesignate funds from other projects if given the chance. Your response to that?
Well, first, let me say that we all run for these jobs, and in any of those elections, folks win and folks lose, and it's hard either way. I mean, I've certainly been with my family through the losses. I've been fortunate to have some wins too. What's difficult and strains relationships and abilities to work together, and sometimes the things that you'll hear and say is when it can kind of grab us and it's hard to let go of. It can make working relationships difficult. But as far as this call, again, no one has come to me to ask for any additional special session. I just want you to go through and think about what we did in this last one and what you always do for special session, right? Y'all have covered this a long time. You never call a special session unless there's full agreement ahead of time, and you've seen exactly what it is. You got to have an agreement between the governor, the House, the Senate. And so the one we just had, before we ever called it, we had multiple in-person meetings and multiple meetings through the phone. Haven't had one meeting here. We exchanged drafts of actual bills back and forth. Haven't had that here. We haven't received a bill that shows where any money is coming from or what the program would look like. I don't know that the senators that are talking about it have met with or talked to the House about it at all at this point. And in this last one, I even drafted the call and showed it to them. And they looked over it and approved it. None of that's happened here. So, we got to step back and look at is it real, or are people pushing different things for different reasons? None of the work has been done by those that are mentioning this that would be required for a special session. And remember what happened when Matt Bevin called a special session without agreement? Right. And that's a whole lot of what would be going on here, which we cannot do. And listen, I think a lot of this is about being unwilling to truly do what it would take, and it wouldn't cost us a dime to alleviate this crisis in hospitals, and that's require masking. Masking has flattened the curve every single surge we've had. And when I had the power to do it, we prevented our hospitals from being overrun. We were one of the only states that could say we had never experienced that. But now without that authority, look at what's happening. So unfortunately, sometimes things in Frankfurt are more about blame than solutions. I'm willing to talk to anybody about solutions, but we actually have to talk. It would help. All right, Sarah Ladd, Courier Journal.
Yes, thank you. I want to follow up and ask about the shooting in Louisville yesterday. What's the state's role in this ongoing crisis of youth homicides? I know our mayor and police chief have said that state laws kind of handcuff the city's ability to enact ordinance to crack down on stolen guns. And so along with that, do you plan to push for legislation allowing Louisville to pass ordinances requiring stolen guns be reported or securing guns? And is there a way to look for common ground with Republicans and pursue solutions on this? Thanks. I know that was long. Thank you.
The shooting in Louisville, just yesterday, of 3 kids at a bus stop, one of whom did not survive, is every parent's worst nightmare. It's not supposed to happen in this world. Whether it was random or not, it took the life of a child of God, and kids waiting to go to school. Doing everything they can to better their lives, being put in that type of danger. It's not acceptable, not right. And the level of violence that we have seen can't continue, and we can't allow it to. And I think, obviously, it takes a lot. And I think lots of people have lots of the answer. But I hope everybody can continue to talk, because most of the time finding the best answers include taking a piece of what everybody has to offer. There's a lot culturally we need to do. But I also think that strong law enforcement is absolutely essential to stopping violent crime. And we ought to be able to do all this, all of it. We ought to be able to police in the right way and at the same time be really supportive of law enforcement. We ought to be able to provide the type of security in every neighborhood in the right way. And right now we haven't lived up to those things we ought to be doing, and look who pays the price. I do think the state can play a role in the identified areas that are brought to us if we are hampering the ability to stop some of these things, and then we ought to look at anything that someone suggests is causing it. We can also provide more opportunity. We can provide more opportunity and more hope in places that don't have enough and maybe haven't seen enough in generations, leading to despair or chronic lack of hope. That can be investment in training, investment in institutions that are already in those communities, working to lift people up, listening to the community leaders that have so many of these answers. But commitment. As a parent of 2 kids going to school, we've been putting dollars into transportation projects where we've seen too many wrecks of people getting to school, wanting them to get safely at school. And you look at what happened here, and it is not supposed to happen. And I hope that we can look at different ways, and I hope that as quickly as some of it has accelerated, that we can find answers and ways to create the world that those kids deserved, and not the one that they're living or dying in. Alex Akisto from the Herald Leader.
Hi, Governor. My colleague, John Sheeds, this week reported a series of stories that detail the pattern of mistreatment of youths housed at juvenile justice facilities across Kentucky in recent years. We want to know what your administration plans to do to openly address this problem and fix it. Thanks.
Well, we're certainly looking at that story, but also any of the information that underlies it. When someone is in our care, they need to be safe, and that is our responsibility. Kids, we call them juveniles, they're kids that we are housing, shouldn't be hurt on our watch, whether that's in foster care or a juvenile detention center. If our goal is to truly eradicate abuse of all types, child abuse and others, then we certainly have to look within our own institutions and ensure that we are doing it right. One child mistreated is unacceptable. Certainly any efforts not to be transparent about a child that is mistreated is unacceptable. So we'll be looking at each of those instances because it can't happen on our watch. Melissa Patrick, Kentucky Health News.
Hi, Governor. I hear you loud and clear that you're waiting on some sort of proposal from the General Assembly with some details regarding calling a special session for staffing issues in healthcare. But President Stivers told the Courier-Journal recently that an option to look at would be to use rainy day fund money. You get a proposal that the funding would come from that. Would you consider it? What's your thinking on that?
So I had the ability in states of emergency to use rainy day money without having to have a special session until it was limited in the special session. If you look at my call, I even tried to use the $69 million for a wider variety of things, and that was narrowed. In a normal state of emergency, certainly in the first 30 days, I can already use those funds. Also, we don't have anything directly from hospitals about what it would do and how it would work and whether or not it would be effective. I mean, we provided $1.8 billion in additional funding. So let's make sure if we're going to throw more money, and I get it, it's a crisis. We want to be there when we need to, that it's actually going to work. I've talked before about my worry that when you throw money into an arms race, all you do is make it more expensive. So let me go over again. If we're paying a nurse $45,000 and the staffing agency is offering $55,000 and we're able to provide extra pay, and so we raised to $55,000, what's the staffing agency do? They pay $65,000. And how do they make up for that? They charge the hospital that desperately needs people a larger hourly rate. And the hospital potentially comes off in a worse place. We got to make sure that we don't do that. There may be a way around it, but here is one way around it. Those 510 National Guard men and women are being provided at no cost and create no competition. The nursing students as well, the testing as well. We have been working to the tune of $1.8 billion and tens, if not hundreds of millions of extra dollars and services since the very beginning of this pandemic. And what we've never done without a plan is just to throw something out there because it sounds good or because we think that it ought to be considered. We are deliberate on all of it. And that's why, I think we've got such a good working relationship with all the groups. But again, remember, the reason that I can't right now help out with rainy day funds are because of the limitations from the General Assembly. Also, I think we ought to think about the best timing. Sometimes when you pay a bonus, people leave immediately afterwards. Certainly, we're going to have more ARPA funds that I think we should be providing bonuses to essential workers when we can appropriate them that have worked throughout the entire pandemic. In other words, we create an incentive to make sure that we get all the way through it. All those things are things to think about. But again, if the Senate hadn't talked to the House and certainly hadn't sat down to talk to me and there hadn't been an exchange of drafts, none of the work has been done that everyone believes should happen for a special session. And every special session has been disastrous that work hadn't been done. James Pilcher, Local 12, WKRC.
Good afternoon, Governor. We've talked a lot about the staffing shortages at hospitals today. What concern do you have that that's only going to be exacerbated by the federal mandate on vaccines, which goes into effect on October 1st? Many hospitals are saying if you're not vaccinated, you can't work. St. Elizabeth's hasn't given us a rate, but Cincinnati's biggest hospital system says their staff is only 80% vaccinated. So that means 20% of their staff might have to not be able to work. I don't know what the numbers are in Kentucky. Don't know if you have any numbers on that, but what concern do you have overall and what color can you provide to that issue?
Well, I think our situation is unique, and so my concerns aren't as great as they might have been if I was governor of another state. Most all of our major healthcare systems came together months ago and made the commitment to ensure that their entire staff was vaccinated. Most of those deadlines have come up. We see a little bit of tension there in northern Kentucky. But what we're seeing across most hospital systems is a very small group that in fact, even our hardest hit hospital was able to replace the folks that they lost already. I mean, when St. Clair tells you, with everything they've been through with the FEMA strike team, with 3 new ICU units that they have confirmed, that converted with the National Guard at the presence they're in, that they were able to make up the staffing because of this, I believe that others can too. And I still, how do we weigh what it's like in a pandemic right now if you're in a room with a healthcare professional that doesn't believe in vaccinations? I mean, what harm comes from that? I think it's critically important that healthcare workers get vaccinated to save their own lives, to not bring it home to their families. But remember, these are also the folks that are giving advice to so many other people out there. And just a little misinformation, we've seen what it can do. And when they did that study on, I call it social media, but I'm gonna call it Facebook, and how few people actually created the content of the misinformation that went out there. We got to make sure that we're truly telling people the right things. We are still awaiting guidance to know whether our state workers are going to fall under that as well. We are making plans if that's the case, but I will say it is not, as written, a vaccine mandate. It is a testing requirement. No one is required under what we have seen right now, if it applies to state workers, to get a vaccine. I want you to. I really, really want you to. I care about you. You're part of my workforce. You're our people, and you're serving the state. But what's required is a certain amount of testing if you decide not to get vaccinated. And that makes sense under the science because you're more likely to contract and spread and get really sick. And this way we can take care of you earlier. So I understand there are some that want to call this a vaccine mandate because it sounds strong on getting vaccinated. It's not. It is it's a set of testing requirements based on your vaccination status. All right, that's what we have today. I want to thank the Bullard Company for doing a show and tell today with the newest brand of PPE. I mean, after everything we've been through, how exciting is that's happening here in Kentucky? From everything that company did with PPE to Gravity Diagnostics and others creating testing labs we never have had, we can come out of this thing stronger. And let me tell you, our future is incredibly bright, and we'll have more on that in the coming weeks. Thank y'all.